In this video, we shall explain two different conditions that can result into same clinical manifestations like bulging eyes, pain, and vision problem. These are the orbital, pseudotumor, and thyroid eye disease. So let's start with the orbital pseudotumor. It is also called idiopathic orbital inflammation, in which there is an idiopathic inflammation of the orbital contents. Symptoms includes sudden onset of pain, swelling, and redness. Also, there is double vision due to restricted eye movements. It is usually unilateral, and this condition responds well to steroids. On the other hand, thyroid eye disease is also called Graves' ophthalmopathies, which is an autoimmune condition linked to hyperthyroidism. Its symptoms includes bulging eyes and eyelid retraction. Also, there is dryness, redness, and pressure sensation in the eyes. It is usually bilateral, however, it could be asymmetrical. Now let's talk about the important differences between the two conditions. Regarding its onset, it's usually acute in orbital pseudotumor. However, it tends to be chronic and it may worsen with thyroid fluctuation in thyroid eye disease. It is usually unilateral in orbital pseudotumor, and exceptionally it could be bilateral. While it is usually bilateral, however, it could be asymmetrical in thyroid eye disease. The orbital pseudotumor is usually associated with severe localized eye pain, while in thyroid eye disease is usually felt as only discomfort. Regarding the eyelid signs, the orbital pseudotumor characterized by ptosis and eyelid edema, while lid retraction characterizes the thyroid eye disease. No autoantibodies in orbital pseudotumor, while there is thyroid stimulating hormone or thyroid peroxidase antibodies in thyroid eye disease. Imaging can be helpful in differentiating the two conditions, like MRI and CT scan. In MRI, there is enlargement and thickening of both muscles and tendons, as the blue arrow refers. Also, the lacrimal glands are characteristically enlarged in orbital pseudotumor. It can appear as hyperintense in T2 in the acute stage, while in thyroid eye disease, the enlargement is restricted to the muscles with the sparing of the tendons. Also, the lacrimal gland is characteristically normal.